I'm going to introduce our last two presenters. Purvi Bhatt is the Senior Director for Strategic Health Initiatives at Levi Strauss & Company. She leads the company's global employee HIV/AIDS program and advises on HIV/AIDS activities for the company. She has more than 15 years of experience in the public and private sector in strategy development and designing, managing, and advising initiatives in HIV/AIDS, corporate social responsibility, and international health. She has led strategic public-private partnerships, HIV/AIDS planning initiatives, and implemented successful startup HIV/AIDS programs around the world for organizations including USAID, USGAO, CARE, and Abbott Laboratories. She serves as a technical advisor on several international health and HIV/AIDS working groups, technical advisory committees, and serves on the Global Health Benefits Institute Board. She holds an MPH from Yale University and a BA from Northwestern University. In addition, Kirk Hansen is Executive Director of the Markula Center for Applied Ethics at Santa Clara University, and John Courtney Murray, SJ University Professor of Social Ethics. He has been at Santa Clara since 2001 when he took early retirement from Stanford University, where he taught in the Graduate School of Business for 23 years. He has written extensively on the ethical and public behavior of corporations and has consulted with over 100 organizations on managing ethics. Hansen currently serves on the board of the Skoll Community Fund and is honorary chair of the Center for International Business Ethics in Beijing. In 2007, he received the Lifetime Achievement Award from the Aspen Institute Center for Business Education for contributions to business and society. I think that this is a good time to bring them up, and we couldn't have two better people to end the session for us. Thank you very much.
Thank you, everyone. While we're getting the slides reorganized, I had a really tough challenge in thinking about how am I going to kick this session off. I thought, well, let me think about what Celia said and carry on the revolution. My colleagues met me in the ladies' room just during our break and said, try to make sure you're not the last woman speaker. Your gender balance and what you're going to do. Then I thought, well, maybe that's not enough. So I thought, well, let me see if our colleague from Coke can help me out. And he gave us good advice. Make sure that the crowd knows the brand. So, Levi's. I don't know how many people know Levi's in the crowd. Raise your hand if you know Levi's. All right, keep your hands up if you know Levi's HIV story. All right, so we have something to talk about today. And then finally, and I think most importantly, I really am going to tip a hat to York, because the reason why we're here is really for the students in the room. And in carrying forward what the journey of learning really is, and that does not end at school. I am proudly the next generation of leaders at Levi's, a company that has been growing many generations of leaders in the CSR movement, well before it was even called the CSR movement. Also growing many generations of people who are part of the global business response to AIDS, well before it was called the business response to AIDS. And so it's really a great privilege on behalf of the employees of Levi's who are coping with HIV every day, the communities that we serve, who are also improving access to HIV services, and the supply chain that helps make our product, but is also located in many of the heavily affected countries in the world. I'm happy to be here to be able to share our story. Oh, sorry. This one? Okay, great. Well, I hope you heard all of that. It was all entertaining and fun. So I'm here to talk about Levi's, and I'm sure it may be surprising to you, it certainly was to me, having come from Abbott, where I had my CSR training. What does a company that has absolutely nothing to do with the HIV/AIDS response, seemingly, what is that company doing when it comes to HIV? Why are we even involved? And you'll come to find that it is a rich and a very important story, but as many of us today will tell it, we can't just rest on our legacy alone. We do have the legacy in HIV. We were the first business to respond to the epidemic when it was an epidemic in the way that we knew it 30 years ago this year. So this is something that we have really taken on as a long-standing part of our history. To set the context, our company, like many of the other companies in the room, could respond to any number of the MDGs and can say we contribute to all of them, some of them, but today for my talk we're only going to talk about the issues that relate to HIV, and we do take a big level ownership of the MDG that supports that, as well as the universal access challenge that's been put forth. But all of it anchored in the first principle of the Global Compact, which is really around rights. HIV is one of the key health issues that really has brought forward a rights-based response, and you'll see this as we go forward in talking about what Levi's has done. Some statistics, the numbers are huge. They've changed over the course of the year already. The biggest one for us as a company, and I do represent the employer's perspective from the company because I work in HR and I support our employees, 50% of U.S. companies with employees that employ more than 750 people report cases of HIV infection. That's surprising. I think a lot of folks, especially as we think about the U.S. epidemic, think that we're done, and we're nowhere near done. So this is a very important statistic for us as we go forward. So the Levi's story, for nearly 30 years, we've taken a comprehensive approach, but I need to really anchor it in terms of where we began. We began 30 years ago, well before the virus is even named, because employees in the Bay Area were struggling with an unknown virus, and as a company, we needed to respond. Those senior-most leadership, Bob Haas, who was the chairman and CEO at the time, responded shoulder to shoulder with employees to make sure information was made available. What is important about that is the courage that it takes, and as we go through this presentation, and especially in the call to action for students, is the importance of standing for innovation, standing alone, and having the courage to do it. Leaders that have made a difference in any of these health issues have done so because of that courage, and Bob Haas kicked us off as well. But since we began, we applied every tool in the CSR box that we had to this cause. We've gone from addressing the need for our employees, to moving forward with community organizations, to moving ahead with public policy dialogue, putting our brand power as best possible to make sure that when the new generation is trying to learn about HIV, they see a hip and cool brand up against that topic to make it less stigmatizing for them to try and get tested and learn more. And then, of course, engaging our leadership and then sharing our best practices, especially in the apparel industry, which interestingly is one of the laggards in responding to this issue. What we learned very quickly is with a cause like this, you can never rest on your laurels. In 2006, it became very clear that we were not doing as much as we could where HIV was concerned for our employees. We began in the very beginning. We were very robust with a business response. We were doing probably one of the most comprehensive responses that an employee-oriented program could do back in that time. But as our industry changed, as we became more globalized, and to be quite honest, as the pandemic changed, and drug prices were dropping, many other companies, impressively, were getting more and more involved, and rightfully so. And we were lagging behind. We were not addressing the HIV needs of our employees all around the world, and as a result, it became very clear that we needed to revitalize this effort. We became much more of a global company than where we began, and in order to be responsible as such and stay true to the commitment that we had, we recodified our effort for employees and made a very large and public commitment at the Clinton Global Initiative that we would deliver on a promise of improving access to prevention, testing, treatment, and care for all of our employees and their families worldwide, and that's in over 45 locations around the world. That point becomes important as we get going. And then to share best practices, again, across the apparel industry, an industry that has not been responding as robustly as some of the other industries that we all represent. What did our employees tell us? Well, we have a very enthusiastic legacy, as I've said, and many of our employees are eager to learn more about that legacy and contribute. We are located in a lot of different countries with varying levels of HIV. Outside of South Africa, I'd say we're in low and rising incidence countries. We are not in high prevalence settings outside of South Africa. So the response that we bring is a very different one. Many of our employees are concerned about confidentiality and discrimination, and we also realize that they don't know as much about HIV as we would have thought. So what became important is that we needed to recraft our response. It wasn't just about access to treatment. It really became access to a comfortable and confidential place to work and improved information about HIV again, because this pandemic refuels on those who don't know anything about it, and we were taking that responsibility very keenly. So when we started to take a look at the business dilemma, how do we really respond to HIV, which is an issue that's impacted by social stigma, as a global company? And we need to really think about how we could do it in an equitable way. How can we design something so that the one person sitting in Turkey has the same opportunity to the 50 people who may be positive in South Africa? We had to make sure we were true to that promise. And then how do we redouble our efforts to make sure privacy and non-discrimination can continue within our labor force? In order to move forward, we had to take a look at our landscape. We all are very familiar with benchmarking, and we had to do the same. There are lots of best practice stories in HIV, but a lot of those stories are anchored in on-site services with companies that have doctors and nurses and clinics on their own payroll, in big manufacturing sites, typically in sub-Saharan Africa, often in South Africa, and are really delivering clinically oriented care. Nothing about that equation resembles Levi's. We have some manufacturing, not a lot, again, not located in a lot of high prevalence settings. Our business model is really around marketing and retail stores, and it became very clear that even in those industries, oil and petroleum, for example, the retail staff of those industries are often the toughest to reach with information, and because of their high turnover as well. And so we realized that there really wasn't a lot for us to learn from. And then finally, the tools of human resources were not always universally applied. For a company like ours, where we don't have doctors and nurses on payroll, our best effort to improve access to services is through a third-party payer, through the insurance industry, through connections with local nonprofits and a functioning public health system. All of that implied that the third-party payer was a part of the conversation. And what I'm sure many of you may know, that while the pharma industry was very much a part of the HIV revolution, the insurance industry was not. And so it made it increasingly difficult for employers like us to be able to truly improve access because we don't have the tools available to do so. In order to frame up our new global program, we needed to have some global principles because it became clear again, we're in such a mix of places with such a range of employee types, from retail to marketing to some factory employees. We had to find the right equitable way of delivering on our service. We needed to focus on affordability, availability, and acceptability of our services, ensure equity, looking again to the one person in Turkey and making sure that they have everything they need as much as we do for the 50 or 60 in South Africa. Focus uniquely on HIV because we felt strongly that while embedding in wellness is important, there's enough happening with non-discrimination issues or concerns about discrimination and stigma that we did need to focus uniquely on HIV. Manage our expansion, really double back and make sure our workplace policies are supportive, refocus our effort on education because, again, so many of our employees were not knowing the basics about HIV, leverage partnerships, and again, capture our lessons and share our best practices. We then, and we continually, every time we roll out to a new country, we have an employee HIV survey that goes out so we can understand what's happening for our employees. This is an aggregation of about 13 different countries that was presented to our board, and it was definitely eye-opening because people felt it's Levi's. Everyone must feel safe at Levi's where HIV is concerned. Look at our rich history. What these statistics showed us was that a quarter of our workforce is worried about HIV, no matter the prevalence, which was very interesting about this. So at least 30% knew someone who was positive. The big one was that the high level of concern about promotion. That 30%, again, no matter where you're located, was worried that they would not get promoted if they were found to be HIV positive. Nearly 50% were worried that they wouldn't have a supportive set of colleagues. And then, again, 44% didn't know where to go to get HIV-related information. This caused for a big concern for us and woke up a lot of people in our senior management. So then in addressing the dilemma of access, we chose to use the definition of access provided to us by the WHO, which really broke things down in terms of making sure services were available, acceptable, and affordable. If you could mix that up in some fashion, you were really moving the needle on improving access. For us, those hurdles of affordability were clear. What it costs to get treatment in Europe versus what it costs to get treatment in India or in China or in South Africa is remarkably vast. So how are we going to be able to provide equitable access with that in mind? Unfortunately, insurance policies were excluding against HIV, so it was very difficult for us to be able to move forward with insurance plans, so we needed to get over the affordability issue. Availability, again, no on-site services, and we needed a functioning public health system. Luckily, in many of our locations, we were able to locate that, and acceptability was all about workplace stigma and making sure that our workplace was set up to be supportive for people. In order to do that, Here are the components of the program that we crafted. The first being making sure that we had a worldwide HIV/AIDS policy. Levi's only has 3 global policies: a code of conduct, a terms of engagement with our suppliers, and now an HIV policy. In order for this to succeed for us, we had to make sure that the HIV policy was 100% embedded inside of the code of conduct for business, so that it became a business issue, and the protections offered for employees were also the same protections offered under the code of business. So whether it be HIV or the secret shade of blue, it is covered under our code of business. We have an HIV survey, which you've seen some results from. We engage our managers in learning more about HIV, our employees and their dependents, and then providing treatment and care has everything, again, to do with the insurance industry or a functioning health system. So if you're in the UK, we probably won't be providing much more than what you're likely getting from the national health system. But if you're in India, we will pay 100% of your HIV-related testing, treatment, and care costs, because the health system there is not functioning in the way that our employees would like, and we can't get it covered through a local insurance provider. So the inequities in insurance. Now this is back to the courage to stand alone and to innovate. We found that there was a problem because of the problems with the insurance industry, and we had to solve that quickly. We needed to create a gap-filling insurance plan so that if you could be located in anywhere in the world, there would be a third party that would provide confidential reimbursement for testing, treatment, and care. We found that 13 locations were excluding against HIV and then developed this plan. It's voluntary, and it ensures equitable access that we had to create for ourselves. It covers all expenses, and it's available to all active employees and their legal dependents. In South Africa, just to quickly bring this to life a bit, HIV prevalence at the time when this case was presented was 18%. We are located in Cape Town, Johannesburg, and Durban, with offices, stores, and a factory. Our insurance plan is a mainstream plan for the office, we discovered. We have a union plan for the factory, except it did not uniformly cover for HIV, and our retail store employees did not have coverage for HIV. In 2008, we kicked off. Now, every year, 400 employees are educated annually and mobilized to get tested. We have one of the highest testing rates for employers of our kind in South Africa at nearly 80%. We added the additional benefit, so now everyone is able to receive reimbursement in case management. And we have a consumer-focused effort in South Africa that is really looking at improving issues around stigma and discrimination and trying to get young people to get tested, and it's called Red for Life. It's attached to our marketing program, and it makes sure that every bit of what we do to market our genes every year is brought to making sure we get kids in to get tested. Year on year, we've done very well in sales with that program, as well as done very well at getting people tested. So it's been viewed as a true CSR effort where business results are also coming through. To cap things off, some of the lessons that we've learned that following those principles became very important. Everywhere we go, we make sure that we go back to the original principles and make sure that especially equity is coming through. Assume nothing. We thought that things in terms of confidentiality and knowledge with our employees were fine. In fact, that was not the case. If anything, we had to redesign things to make sure we addressed that well. Working the data and making sure that we double-check the coverage of our insurance plan was really the innovation that we had to bring to this equation. For us, the next step of a business response to HIV involves the insurance industry. It cannot proceed without it. And so we are now putting our brand power to make sure we help bring that industry into partnership with us. Ensure authenticity. While we have many employees around the world that are willing to do an AIDS walk or write a check, those same employees don't know about HIV for themselves. And so we're now bringing that forward to make sure that they understand the importance of HIV for their own lives before they start taking that walk or writing a check. And then again, using the brand and embracing innovation. We've learned the very hard lesson over the years that really having a commitment to this is really staying the course until we're done. And that oftentimes means going back to the beginning again, the way we did. We've lost many. Unfortunately, we have a AIDS quilt panel from the very beginning, and now we're seeing ourselves train and teach our retail employees in a store in Turkey, trying to make sure that the next generation gets what they need. If you want to learn more, you can certainly find us. The HIV program information, based on what I've just been describing, has its own website, as does all of our community efforts with HIV on our external website. So, thank you, and I'll turn it over to Kirk.
And I, besides being the last speaker as a male, which I'm glad to do. I just have 2 points to make. This paper is a collaboration between Porvi and myself, and a dialogue about why this is a significant breakthrough. And so the first of 2 points, it is a significant breakthrough because it represents one of the fundamental problems that businesses face in operating globally, which is you can have the best intentions at the corporate headquarters, and the implementation of a good idea is very hard to achieve. In anti-corruption activities, we've seen that. I did a survey a couple of years ago of major companies. Half of them had never translated their code of conduct into Chinese, though they had a Chinese operation. The kind of innovation that Levi's has done here, which is to say, we admit our AIDS program, which has always been path-breaking, is not available to certain of our employees, is really an open, transparent kind of admission, and then to take the kind of initiative to find a way to get it done, even with the barriers of the lack of insurance, the stigma that exists in some of the societies in which they operate, really represents the cutting edge of corporate commitment to say, okay, this really does have to be implemented globally. So that's one observation to make. The second observation is the one raised earlier, which is what kind of company does this sort of thing? I've been in this field. I've been coming to all these conferences for 30 years, but I've been in this field for longer than I want to say. I joined Levi Strauss & Company's community relations program before Porvi was born, okay? That either gives you an idea of how young she is or how old I am, or both. But Levi's has this incredible record over the years of taking social stands. And you say, why? Well, partially there's family tradition, partially there is today private ownership, although it had been public for a while. And the question, of course, is whether we can recreate that across the board. Novartis is taking an incredible leadership position today. Sumitomo Chemical is taking a great leadership with the malaria nets. Is that going to be sustained? Over the history of 40 years that I've been in this field, different companies have taken the leadership, and we've lamented those where a CEO changes and suddenly a company which was taking a leadership position drifts into the background. And it's wonderful that these companies and others represented here are indeed taking the lead today, but will they tomorrow? And how do we create and sustain? And I think the question which was raised, which is there something different going on today, is of the essence of this question for you students, is how do you pick the company? Is this a different era in which you can go to a company with a global sense and count on that lasting over time? Or is it dependent upon the individual CEO, the individual leadership team that's currently in place? I don't think there's an answer I have for that over my lifetime. I guess I've seen very few companies like Levi's that were the first ones to desegregate plants in the South in the 1950s, which pioneered the whole supply chain concept of being concerned about human rights and environment. That was Levi's again, which pioneered this HIV/AIDS active program. Very few companies with that kind of staying power, and that's the challenge, is hopefully that we can have companies, large and small, which have this as a fundamental part of their philosophy going forward. The Global Compact hopefully makes a substantial contribution to that agenda. Thank you.
Thank you very much to our presenters for noticing my fingers and for staying on time. Really appreciate it. Father Ali, do we have any time for questions, or are you going to just take us to the next session?
Maybe one question.
Okay. Your question, or?
No. I'm too smart. Okay.
Okay.
I just want to say, Kirk brought up the question of age. I was a child prodigy, you know, Kirk. I just,